Hi guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we are discussing about 15 basic and important AR calling interview questions in medical billing along with the answers. And guys, if you are watching my video first time and if you are not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every my video as a notifications to your mobile or your desktop. Okay guys, now we are discussing about the first question. Tell me about yourself. This is the basic and important question. Example I given. Hi, myself Krishna and I'm 26. I live in Hyderabad since 2020 along with family, and I graduated from so and so college with 51 percentage in the year of 2023. I'm good at communication and interpersonal skills, and I can trust the people very quickly. Coming to my hobbies are enjoying the nature, capturing the photography, listening to music, and playing the cricket. Guys, freshers need to do more focus on this question and along with the answers. And this answer should be very sweet and simple. Okay, guys, now we are discussing about the second question. What do you know about medical billing? Here I give an answer. Medical billing is the process by which doctors and hospitals receive payments from health insurance companies. After patients take the treatment from the doctors, here generally the doctors will submit the medical claims to the insurance companies so that an insurance companies will review the medical claims and gives the payments to the healthcare doctors. This is about the medical billing process. Here I also given definition. Process of submitting and follow up on claims to an insurance companies in order to receive payments for service rendered by the doctor to the patient. This is about the medical billing and medical billing process. Okay guys, here the next question is what is mean by RCM? Here revenue cycle management is a process that manages claims processing, payments and revenue generations. RCM process begins when a patient schedule an appointment with the doctor and ends when the doctor has accepted all payments. Here the purpose of revenue cycle management is to reduce the billing errors so that reimbursements are nothing but payments will increases to the doctor from the insurance companies. Here I given steps like here RCM steps are nothing but patient scheduling, transcription, coding, demo and charge entry, claim submission, payment posting, denial management, and AR calling, and finally we are reporting to the client. These are about the RCM cycle steps. Okay guys, now we are discussing about the third question. What is premium? Premium is nothing but monthly amount paid by the subscriber to an insurance company to keep his policy active. And here the next question is what is the standard Medicare Part B premium for the year of 2024? So Medicare Part B premium is $174.70 per month. Guys, here I given one question. What is the Medicare Part B deductible for year of 2024? And comment if you know the answer, comment your answer. Okay guys, now we are discussing about the fourth question. What is modifier? Enhance the description of a service or giving an additional information about the treatment to an insurance company to process the claim towards the payments. So just it is giving additional information about the treatment, whatever the doctor is given treatment to the patient. For that treatment, it is giving some additional information to the insurance company so that insurance company will understand and process the claim towards the payments to the doctors. And coming to the next question, could you please explain about modifier 76? Or they will ask that interviewer will ask that do you know anything about modifier 76? Here modifier 76 explains about the repetitive procedure on same day by the same doctor. Nothing but the treatment is repeated in a same day twice. For example, in morning hours the treatment is given by the doctor to the patient, and by the same doctor at the afternoon hours also treatment is given by the that same doctor to the patient. At the time that procedure or that treatment, we can call it as a repetitive treatment or repetitive procedure. So if you are submitting claim to insurance company without modifier 76, the insurance company will deny the claim, stating that we are not giving the payment for the afternoon session, only we will give the payment for the morning hours treatment. But the doctor is given services twice, right? So here we want, for that also we want payment, but you are not appending the modifier. For example, I am telling, so at the time insurance is denied. But if you are appending modifier 76 to the procedure, then insurance will understand that okay, this is a repetitive procedure by the same doctor at that different timings. Morning hours one time and afternoon time is different. So the timing is different, the doctor is same, service is also same, patient is also same. But this thing, how the insurance will understand? Only because of your appending modifier 76. So here 76 modifier giving additional information about the treatment to the insurance company. So this is about the modifier and modifier function. Okay guys, now we are discussing about the fifth question. What is Medicare and Medicare eligibility criteria? Medicare is a federal health insurance program, and people with age of 65 or older are eligible for the Medicare, and also the people who are suffering with kidney failure disease like end stage renal diseases are also eligible for the Medicare, and certain younger people with disabilities also eligible for the Medicare, and the people who pays tax since 10 years also eligible for the Medicare, and also the people who add SSN services for 24 months also eligible for the Medicare. Okay guys, now the sixth question is, who is called PCP? PCP is nothing but primary care physician, and here the answer is the doctor who is visited by the patient first is called as a PCP. So this doctor will give a approval to a patient to consult a specialist. That approval is known as a referral. So this doctor is also called as a referring provider, and this doctor is also called as a primary doctor. This doctor is also called as a family doctor or also gatekeeper. So this is about the primary care physician. Okay guys, now we are discussing about the seventh question. What do you know about clearinghouse and which clearinghouse used in your previous company? Guys, this question is for minimum 6 months or minimum 1 year experience people will get this question on interview. Generally, clearinghouse is nothing but an intermediate entity or software or intermediate entity between doctors and payers to submit the claims electronically. Guys, if you are submitting any claim through electronically, your your doctor side have one software. You should have to submit your electronic claim of your doctor through that entity. That is called as a internal clearinghouse. If that claim is processed through that internal clearinghouse without any rejections, it will move to payer side. So payer side also there is a one clearinghouse, it is called as a external clearinghouse. So if your claim is processed through your internal clearinghouse as well as external clearinghouse, it is known as a, that claim is called as a clean claim. So here you should have to understand that here what is clearinghouse is nothing but it is an entity between your doctor side and insurance side. So example here given for clearinghouse example is Waystar. And coming to next one, second question on this seventh one, what is your doctor's billing PMS, practice management system or software name? So generally, global software, I give an example like a ECW, eClinical Works. So this ECW is the software, general software for healthcare systems, billing doctors using this software. So this ECW is the software, is nothing but you will get every information about your claim. And once insurance process the claims, they will give the EOBs to doctors. That EOB also available in this software, and complete, if you are giving your claim number, account number, you will get complete claim details in the software. So that software is designed by your internal doctors, and that complete medical records, complete patient information, insurance information, and complete claim information and denied EOBs, everything is available in that particular your internal doctor system. It is called as a your doctor's billing PMS or practice management system. Here example is ECW. Okay guys, here eighth question is what is mean by release of information, ROI? So here answer is patient authorized. That is nothing but patient is acknowledged and signed on a paper to release of other medical information to process the claim towards the payments. So here patient is signed and are acknowledged on a paper to release other medical information to process the claim. So sometimes insurance is pending the claim because some information is required from the patient. So sometimes even patient is given information, he is not signed on a CMS 1500 box number 12, then insurance is not giving the payments to the doctor. So they are telling that patient is not acknowledged. Once patient is signed on a paper and on a CMS 1500 claim form, then insurance will understand that patient is acknowledged. So in that way, if you are not signed on a paper, it will be not processed the claim by the insurance. So here anyone, if they are asking what is release of information, is nothing but patient authorized to release other medical information to process the claim towards the payments. Okay guys, we are discussing about the ninth question. What is mean by ABN? ABN is nothing but advanced beneficiary notice. Here the definition is an advanced beneficiary notice of no coverage of a services or items that Medicare does not cover. A written notice signed by a patient before service rendered by a doctor. That notice clearly explains that some services may not covered by the Medicare. Example, eye examination, cosmetic surgery services, and hearing services are not covered by the Medicare. Okay guys, now we are discussing about the 10th question. What is mean by pre-existing condition? A medical condition that started before health insurance went into effect. So whenever you are trying to take any health insurance from the insurance companies, so before buying that health insurance, if you having any medical condition, for example if you have any disease, so that medical condition prior to buy any health insurance is called as a pre-existing condition. Okay guys, now we are discussing about 11th question. What is mean by Enm codes? Here Enm is nothing but evolution and management codes. So here Enm is face-to-face conversation with the patient or patient family. So conversation happens between the doctor and the patient or patient family. So there is a conversation between the doctor and patient. So what are the symptoms, what is the this particular disease of previous history of this particular disease, and what is the, for example, the patient is went for follow-up visit, at the time how many days it is observation and medication taken, this kind of conversation happening between the patient and doctor. That face-to-face conversation happen is nothing but ENM codes. So sometimes, patients schedule an appointment through the phone call, and also that conversation, whatever happened between the doctor and the patient over the phone, also is known as a evolution and managements. And here the one more question is, tell me any office visit new patient ENM code, any example. Here I given 99205, and here I given two note points. Office visit new patient ENM codes range from the 99201 to 99205, and also I given one more example. Office visit established patient ENM codes, if the range is from the 99 to 11 to 99 to 15. Here new patient is nothing but doctor is visited the patient first, is called as a new patient, and established patient is nothing but already existed patient, nothing but doctor is visited the I mean sorry visited by doctor is visited by the patient frequently, is known as a established patient. And we have to understand one point: if the patient is established patient and is not visited the doctor since last 3 years, the fourth year he is visited the doctor, at the time he will be known as a new patient, not a established patient as per the uh, AMC guidelines is. So this is about the question, what is ENM code, and tell me about any new patient visit code. So you should have to concentrate on this question, because this will be very very basic and important question. Even for 1 year experience guys will get this question on interviews generally. Okay guys, now we are discussing about the 12th question. What are the common working denials in your daily job? This is for 1 year experience guy, generally we will get this question. So you are working on previous company, right? So what are the common working denial in your daily job? So generally I give an example: not deemed medically necessity denial, no authorization denial, timely filing has been expired denial, and a duplicate denial, and maximum benefits exhausted denial. So if you are getting some other denials apart from this, also you can mention to your interviewer. So here guys, in our channel there is a playlist AR denial management videos. Approximately 40 plus denials are available in our channel. If you are watching first time this thing and you don't know, just I am giving this information to go through that playlist, so that it will be very very helpful to you. And complete information I given there, with what is the AR caller steps over the phone call, how to talk, what are the questions need to ask, what is a pre-call analysis on a denial, and what kind of end action you will take particular on particular denial. Everything is given in our videos. And if you need more information, you can explore through our playlist AR denial management videos. And here one more additional question to here is, can you explain your favorite denial or any denial? They will ask, right, what are the denials, you are telling five denials example, they will ask like, could you please explain any denial? Or sometimes what happen, they will if you are telling about timely filing denial, they will ask, if you are not telling any denial, for example, they will ask, oh, by own, tell me about authorization denial. Generally they will ask in that way. But if they are asking, can you tell me or can you explain your favorite denial, generally you will tell that there is no favorite denial for me, I'm good at uh, three or four denials. But you should have to explain any denial by your choice. So explain any denial where you good at. For example, the above mentioned all denial video links given in the first comment of this video, also in the description area. Kindly explore the link for your complete information. Because I mentioned 5 denials, that 5 denials I would like to provide the links in the first comment of this video. Could you please explore for that 5 denials? If you need more denials, please go through AR denial management videos playlist in our channel. Okay guys, here now we are discussing about 13th question. How many claims you closed per day? So I given answer is I complete 40 to 45 claims per day, including calling and non-calling accounts. And for example, you are only working on a non-calling accounts, you can tell like 60 plus claims. So here on an average I given this answer. See guys, this answer is depends on your daily inventory, nothing but it is depends on your uh, payers. So on which payer you are doing calling to the insurance. For example, you are calling to insurance on a BCBS. I think holding time for that particular payer is so much high. So at the time your count will be less, so they can understand on it, okay. So some are depends on payers, the holding timings is different to getting the claim status over the phone call, so count will be less. For example, you are working on your internal sources, like for example, you are checking your claim on your uh, I mean, respective payer portal if you are have a access, and you are checking in your status in a clearing houses, and you are checking your status in your respective practice management system if already UOB is available. At the time, there is no much time is required compared to the calling to the insurances. At that time, your count will be more than 55 or 60 plus claims. So in that way, so tell to interviewer that it is purely depends on payers and source where you are finding the claim status. And here the next question is how many insurance calls you do per day? Here I answer is I do 15 to 25 calls a day. Okay guys, here the 14th question is a medical claim billed to Aetna with billed amount of $500 even. Billed amount is also called as a total charge amount. So here a claim is billed to Aetna with $500 even, and an insurance Aetna processed the claim and allowed with an amount $100 even. Then what is the Aetna's applied contractual adjustment amount to the doctor? Is the question. So simple, billed amount is given and the insurance processed the claim, I mean adjudicated the claim, and they allowed the claim with amount $100 even. And what is the contractual adjustment? Here the simple question, what is the contractual adjustment? Here the answer is basic formula to find out contractual adjustment or allowed amount or total billed amount is, the basic formula is total billed amount, nothing but total charge amount is nothing but addition of allowed amount and contractual adjustment. So the sum of allowed amount and contractual adjustment amount is nothing but total charge amount. So in this formula, basic formula, we already know that total charge amount is $500 even, and insurance allowed amount is $100 even. So what would be the contractual adjustment is nothing but contractual adjustment from that basic formula is nothing but total charge amount minus allowed amount. Here the total charge amount is already given in the question, that is $500 even, and allowed amount is here insurance processed and allowed the amount is $100 even. So here total charge amount minus allowed amount is nothing but the rest amount is nothing but contractual adjustment amount. So therefore $400 even is the payer applied contractual adjustment amount, is also known as a provider adjustment amount, is also known as a provider write-off amount, is also known as a provider discount amount. You have to note this point. Okay guys, now we are discussing about 15th question, last question in this video. The question is why you are looking for a job change. Guys, this question is also very basic and also very important question. For example, you completed 1 year experience and you're looking for a job change. Definitely they will ask. So because they would like to know what is your mindset or what is the purpose of your doing job, generally why you are joining to some other company, so that they will understand everything based on this your question. So simply, why you are looking for job change, anyone will ask. The answer is for a better professional growth and opportunities. Sweet and simple. For your professional growth you are looking for a job change. I give a note point, guys. Don't do bad mouth your previous employer. For example, you worked in previous employer, because of some other reason you are joining to some other new company. So even there is a bad about your previous company, do not mention to your next company. It is a better. Okay, there might be bad mouth also, even it is a true, you do not mention that thing. So just tell that okay, for better professional growth you are joining this company. So that is the way how we are telling to in a professional way to some other interviewer. And here the next question is, what is your salary expectation? So here this answer also, like in a professional way, tell that okay, as per company norms, uh, it's nothing but choices there you are giving to them, right? As per company norms you will provide, or otherwise just tell that I am expecting 25 to 30% hike on my previous take home. And here the next question, if I selected you right now, when you will join? So here the answer is as soon as possible. ASAP, as soon as possible I will join. And guys, if you are on a notice period, just tell the same to the recruiter. I'm on notice period. I drop the paper. This is for 1 year experience. I drop the paper. There is a 1 month is notice period. I drop the paper on so and so date. I mean, I given resignation on so and so date, and the upcoming date is the last date for me. After that particular upcoming date or next date, I will join to your company. So in that way, tell if you are on a notice period. For example, if you are not on notice period, you already relieved, then tell that as soon as possible I will join to the company. Guys, if you felt the content is useful, could you please like our video so that it will reaches many more needy people? And really thank you so much for your time, and have a good health. All the best. Bye for now.